No problems tomorrow. Clouds increase. Low 40s should feel great. Thursday's storm starts as rain, then a quick change over to wet snow. Right now the model's hitting at 3 to 6, 4 to 6, somewhere in that range for the Twin Cities Metro and much of southern Minnesota. Up to a foot for the North Shore and Duluth. Flurries linger into Saturday.
It's a little breezy out there in Roseville right now. 17-mile-an-hour winds out of the south-southeast. It's 31 on CCO. It's never not going to be funny hearing a guy say he'd rather have a colonoscopy. He was not talking about listening to this show. Or was he? We don't really know. 4:39 here on CCO. There have been a couple of headlines lately about the president and the first lady both being diagnosed with skin cancer, and it made me reach out to my friend Dr. Mohiba Tareen, who joins us in studio from Tareen Dermatology. Doctor, thanks for coming in.
Thank you for having me, Jason. Excited to be here.
All right, whenever I hear about people being diagnosed with melanoma, it makes me nervous, and
As it should.
As it should. What do we know? Obviously, you're not the Biden's doctor, but what do we know about the type of skin cancer they were diagnosed with?
So luckily, both President and Dr. Jill Biden had basal cell carcinoma, which is the most common and low-grade type of skin cancer. Do you know, interestingly, there are more basal cells diagnosed than all other cancers combined. So it really just is something that needs to be taken care of so it doesn't grow into the muscles or nerves.
Why do they call it basal cell? What's the difference in the different kinds of skin cancer?
So basal cell carcinoma starts from the base of the hair follicle. So it's typically on the face, hair-bearing areas. It's due to sun exposure. Again, low grade. The Bidens both got theirs taken care of with what's called Mohs surgery, where we remove the tumor and we check it under the microscope in real time. So it's a really precise, nice, easy form.
Interesting. So they get an answer right away. As a medical professional, when you look at that under the microscope, you know right away?
Right away. Basal cells are more blue than the surrounding cells under. So right away, I take out the cancer, we flash freeze it, and we look at it. So it's really satisfying for patients.
That is satisfying, right? Because you're nervous, of course. Like if I had to go home and be told, you've got skin cancer, we'll check back in 3 weeks.
Right. Because, typically these basal cells will occur on the face. So you don't want a big chunk out of your face. So It's really nice that it can be known.
All right. That is one type of skin cancer.
Correct.
But there are 3 main types that we deal with, right?
There are myriad different types of skin cancers, but the most common are basal, squamous, and then melanoma, like you said. Squamous is kind of intermediate. Many people don't know that squamous can actually kill you too.
It can.
So it can grow as a lump. If you've got a warty growth that's not going away and you're getting to be my age, your age too, Jason.
Yes. Young and vibrant.
That's
that
right.
Age,
Beautiful.
Right. Yes, exactly. Dr. Mohiba Tareen from Tareen Dermatology is our guest. We're talking about skin cancer, and it is, we heard about it with Joe Biden and Jill Biden, and the fact that they were diagnosed in the winter is part of why I wanted to talk about this now, because I think a lot of us feel like, skin cancer is it's a summer thing to worry about. Is there truth to that or not?
No, we know melanoma, 90-year-olds get melanoma. So you can get skin cancer at any time. You should get in with your dermatologist if something's growing or changing.
Is there do researchers have a X amount of exposure makes you more likely, or?
Unfortunately, like all cancers, skin cancer is multifactorial. So your skin type, your eye type, your genetics, if you're immunocompromised, a lot of people don't know certain medicines, like if you're on a medicine for Crohn's disease or arthritis, all these things can play into your skin cancer risk, Jason.
Interesting. So knowing all of that stuff is important.
Right.
Are you like every dermatologist? So Dr. Tareen, you guys can't see this on the radio, but of course her skin is beautiful. So is your secret really you just wear a giant hat all the times and never see the sun?
Honestly, I work 24 hours a day, Jason. I don't have that. So that's the secret, as you do too.
Yeah,
so there we go. We're protected.
There's no UV rays coming into this studio. I'll tell you that much.
That's right.
That is part of it, though. I will say, I've had to learn to wear a hat. That I always wear sunscreen. That's good, but it's not enough. I feel like I need a hat.
You're absolutely right. Physical protection, be it UV protective clothing, hats, That's much more important than sunscreen. You should not be sitting in the middle of the sun between, noon on a summer day. So, yes.
That's a tough sell around here, isn't it?
I mean, we'll be at that 40-degree day when everyone's outside the shorts very soon, right?
So let's talk about skin cancer in Minnesota, because I think a lot of people think, oh, it's cold, we don't get enough vitamin D in the winter.
Right.
Do we get any extra protection from that, or not really?
So this is a double-pronged question. Number one, we do have a lot of skin cancer in Minnesota. That's due to our, fair skin population. But interestingly, do you know that episodic sun exposure, so like all of a sudden a lot of sun exposure, can actually increase your risk of skin cancer more than chronic sun exposure?
Oh, interesting. So,
Yes.
That is very surprising to me, because we go to Florida, we go to Arizona, we go to Mexico.
These bursts of time can actually be worse because your skin is sun protected, and then all of a sudden you get sun exposed. So that has been shown to generate melanomas. Yes.
Interesting. So the body's freaking out a little bit?
Correct. You don't have any baseline protection. So yes, it can be very, very detrimental for melanoma.
You have told me before that Minnesota's in the top 3 states for diagnosis, which...
It's terrifying, Jason.
It is.
Top 3. We don't want to be in the top 3 for this statistic.
Right.
So many people are dying of melanoma, again, due to our Caucasian population. So many of us use tanning beds, those of us who grew up in the 90s and early 2000s.
This was our generation,
Yes.
right? The tanning bed generation for sure.
Right, and now at our age, our cells don't turn over as much, so these melanoma cells generate and they hone into the skin and grow down deep into our lymph nodes and spread.
All right, so we talk about like people who used to smoke.
Yes.
Like if you, I saw a billboard today that said if you were smoking when computer monitors were, the green monochromatic, then you need to get your lungs screened.
Yes.
Is there a similar message for people who maybe were tanning bed users?
Absolutely. Even one tanning bed exposure can increase your risk for melanoma by 30%.
Huh.
One. And how many of us had so many chronic tanning bed exposures?
Does it matter that you've had years of not using the tanning bed?
In fact, it's actually thought to be worse because as we age, we don't get that cell turnover. So, when you're 5 years old, you cut yourself, it heals in a day. You're 90, you die of a cut. So these cells are not turning over.
So I've talked about this before, and people know, like I do ads for you guys, but I went and had the full body checkup, and there were 3 biopsies you did.
Yep, and Jason had a little early precancerous spot on a sun-exposed area. Thank you for allowing me to speak about that.
Yeah.
He's young, he's handsome, but these things can happen. So now, with those cells out, they will never become skin cancer. You are protected.
So when it's removed, you're good.
Margins were clear on you.
Interesting. So I worry about it a little bit because my dad has had many cancerous growths removed, many. And it starts with like a mole where you're like, Dad, like that looks kind of weird. You should have it checked. And now he gets checked all the time because he's had so many. If you have that, I assume if you have it in your family, for me, it just increased my awareness of it.
Right.
But I assume the genetics do end up in play. Right?
Absolutely. Genetics play a significant role in all types of skin cancer. So that, along with your skin type and your medicines and everything like that, you should get in for your full bodies. We see people even up to 3 times, 4 times a year if they have a strong family history.
It was easy. I was a little nervous about it, but it was easy. And even the biopsy was absolutely no big deal.
Good. It should be when
it actually made me feel good, right? Like at the end, you're like, thank goodness, like I know I'm all right.
Yes. I mean, it's an immutable fact. Your cells are removed. They're clear.
Yeah. Dr. Mohiba Tareen is with Tareen Dermatology. This time of year is where Minnesotans and Western Wisconsin, you're sort of itching to get out and get in it. Is this when people make mistakes? You forget about it?
Absolutely. Even now, we don't have a lot of UV exposure, but you should be protected. And coming back to your vitamin D question, we are all notoriously vitamin D deficient, but get your vitamin D from other sources than chronic sun exposure.
I suppose, yes. Yeah, you can get it in food. There are other ways you can get vitamin D. Take a
nice
supplement.
Yes.
Yeah. With the Bidens, and it's sort of the original reason we talked about this, Joe Biden's 80. As you get older, if you have melanoma, are you more at risk of having, a more severe health effect? I know we say death is a risk, and it is.
It's really interesting. Young people often are the ones who die of melanoma, Jason, because again, their cells are turning over. Those cells can metastasize to the lymph nodes. Interesting, older people can sometimes have a better response. Isn't that fascinating?
That is interesting.
Yes.
Oh, we got a couple texts from people. I'll just ask you these questions. Someone asked, why insurance doesn't cover this screening as a preventative.
It should be. It's
Is that something we're working on?
It's a state law in Illinois. Full body skin exams are considered part of a preventative screening, so it goes to not your deductible. So that is something we should bring before the legislature.
But we don't have that in Minnesota.
We don't have that in Minnesota.
So for whatever reason, is it seen as cosmetic? Is that why?
It's not necessarily seen as cosmetic, but it goes to your deductible, and unfortunately, so many people have high deductibles now
got it.
versus purely
where
preventative.
things are purely preventative.
Correct.
Got it. Okay. And Texter, I feel you. I had to pay it towards my deductible too when I got my screening.
Interesting. They did a study a couple years ago. One biopsy costs the insurance company anywhere between $100 to $300. Treatment for metastatic melanoma, do you know how much it is a year, Jason?
No.
$1 million.
Oh my gosh.
Chemo for melanoma is expensive.
And then another question is that I'm 68 and love working in my yard during the summer. I'm allergic to some of the ingredients used in sunscreen. Some of these kind of other sunscreens that don't have zinc or don't have whatever do they work or?
Absolutely. We love mineral-based sunscreens. Typically, titanium and zinc you do not get allergies to because they're inert. They sit upon your skin, rather than the chemical sunscreens like PAVA and things like that get absorbed in. And most importantly, listener, get a big, wide hat.
Get the hat.
Yep.
You know what? You look cool.
You look cool. Very cool.
It was very trendy last summer. The big floppy hat. I feel like not for men. I don't know.
You're gonna bring it in, Jason.
Is that gonna be the thing? I don't know about
That's
that.
the thing.
All right. Well, we hope people go and get themselves checked out and take
Absolutely.
care of it. Dr. Tareen, thanks for coming in.
Thank you, Jason.
We appreciate it. 4:49 back after traffic and weather together.